So this really focuses in on serologic testing for SARS-CoV-2, and we really review the utility of this method for the purpose of epidemiologic and seroprevalence studies, and we outline kind of what the ideal versus the pragmatic components of serologic testing are, and how they would or how they should be applied or would be applied in low to middle income countries specifically. So my name is Ellie Thiel. I direct our infectious diseases serology laboratory here at Mayo Clinic, and the title was Testing for SARS-CoV-2 Health Policy Implications in Low and Middle Income Countries. So at Mayo Clinic, we've really taken our time to thoroughly evaluate the serologic assays that we've implemented for clinical use. We've looked at probably over 20 different methods and selected the best ones for our practice. Those assays have changed over time as new testing has become available. But despite the pandemic, we really focused on maximizing the sensitivity and specificity of the available tests that we're offering clinically. And then we've also tried to be forward-thinking in our approach, specifically with things like, as vaccines become available, even though we don't know whether serologic testing will be necessary, we've kind of tried to think through the potential needs to potentially test individuals after receipt of the vaccine. And so we've made sure to retain different serologic assays for that purpose. Of course, that may not be possible in lower to middle income countries. And so some decisions regarding what assays are available in other locations, we kind of talk about what considerations need to be made there. So we really underscore the idea that serologic testing should not be used for diagnostic purposes when it comes to COVID-19, but again, instead it can be used for seroprevalence studies. That can really be helpful to determine kind of the distribution and the prevalence of the virus within a community, as it would pick up both individuals that have been symptomatic and potentially asymptomatic. Importantly, we continue to learn a lot about our humoral immune response, including how long these antibodies remain detectable, what level of protective immunity they provide. And we're also learning a lot more about the other arm of the immune system, our cellular immune branch, as that likely plays an important role for protection from reinfection as well. So when it comes to next steps and kind of what's out there and what the next phase of serologic testing for SARS-CoV-2 is, I think we really need to take and are taking a deeper dive into understanding what level of protection these antibodies provide against reinfection with the virus. And as I mentioned earlier, there's new and emerging technology that's going to become available to look at our cellular immune response. Of course, how that all plays into testing and how it all fits into clinical laboratory medicine, I think has yet to be determined. But it's something that we're excited to pursue in the future. So I guess in conclusion, we hope that you enjoy this article. It aims to really provide kind of a view in how these serologic assays would be used or potentially administered in low to middle income countries. Thank you for reading the manuscript.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.